you're going to get a couple things in this brief presentation. First is an overview of some of the jumbo and technology that you hear in the media involving artificial intelligence and machine learning. And then we're going to get into a couple use cases in health. All of this really in the goal of bringing together how do we actually seize this opportunity. AI and ML has already been brought up about a dozen times in this first hour here, but I don't think we've really seized the opportunity yet. And so hopefully there's some actionable insight that we have from our experiences that can help facilitate the conversation later today and serve as the action plan moving forward over this next year. This is a non-technical presentation. Some of the data scientists in the room might quibble with this a little bit, but give me a little bit of leeway to explain this terminology, at least in a non-technical sense. The terms are often bandied about in the media all the time, and AI, ML, deep learning, reinforcement learning are often used synonymously. I'd like to think from a non-technical perspective as AI, just think of this as almost that meaningless term. You know, when you talk about some part or all of human intelligence, it almost is that umbrella term within computing science that is so broad that it almost means nothing now and can be that catch-all term. Machine learning is the biggest element within AI where a lot of the action's happening. Machine learning is where we're teaching algorithms, where we're having algorithms that can adapt without being explicitly programmed. So in other words, we're throwing large data sets at these algorithms, and the algorithms are finding patterns and correlations that we might not, as humans, fully recognize or understand. Third, deep learning is where all the fun stuff is happening. Deep learning, and again, the data scientists in the room this isn't technically correct, but think of this essentially as synonymous with artificial neural networks. Neural networks are very loosely modeled after the human brain and how the neurons within our brain have, are basically weightings back and forth to be able to make decisions. Now, each of these areas are distinct. So to a certain extent, you can think of them like Russian nesting dolls. Under comp sci, you've got AI, and then ML, and then deep learning. But in some ways, it's actually incorrect because the lines are blurring. And more now, deep learning is eating ML, ML is eating AI, and AI is the area within comp sci where everyone wants to be. So in the end, think of this as more of that Venn diagram of overlapping interests. Traditionally, if you want to program something, you know what you want to do. You've got your data, you've got your rules. You spit that into a computer, you get a programmer, you get your answers out. Machine learning inverts this entire paradigm. Instead, if you've got some data and you know the answer and that you know where you want to go, what machine learning does is it helps you find those rules. This is really key because if you know the rules, you don't need machine learning. If you know how to program it, just program it. And quite often, we see problems in industry where the approach can be handled in a more simple way, but really we're actually trying to really over-engineer and overkill a solution because ML is the latest buzzword du jour. This is the reason why machine learning will completely impact healthcare and every other industry. There's a new type of network effect built around data. So network effects aren't new. They exist in many different areas of business. Facebook itself, the social network, every new member that's added increases the overall value of the service. Visa or MasterCard also have network effects in their business. The key here is that as you have more data, the algorithm gets better. In health, hopefully we've got better care, better results, and the virtuous circle goes on and on. This is key because it creates barriers to entry and has the ability to really create software that has a competitive advantage over what anybody else could do. A great example of this is Amazon. So we've all probably bought something and said, well, people who bought this also bought that. And then you maybe clicked on it, you maybe kind of upsold and spent another 20 bucks or another 50 bucks. That's just a recommender system. It's not necessarily a complex mechanism within machine learning. But the reason that works is because Amazon has hundreds of millions of customers and billions of transactions on which to base that engine. Let's get into a few examples here. We've all seen examples within radiology and medical imaging being one of those use cases within health. I wanted to highlight this example here within stroke detection. And the reason I'm highlighting this is not because of the accuracy, but rather because of the time to make a decision. So in this particular use case, 95%, it was 95% accuracy, so accuracy was good, don't get me wrong, but it was all about the time and the speed in which that information can be passed on to a clinician. 52 minutes difference, obviously in stroke, makes a huge difference. A second example here. So Google DeepMind, who's in town, as many of you realize, has done a ton of work in the health space. In this particular model, they looked at the baseline for in-hospital mortality. And what you see above and below is the base case of what the existing protocol was, and then the improvement within ML. I share these two examples in the full version of this presentation. We can go through, there's 5 or 10 different examples from across healthcare. But the key here is that we're not eliminating a physician. There are so many examples in the media where you hear about AI is going to just disrupt everything and take all the jobs away. And sure, there are automation use cases. But what we're seeing is that these tools are really being added as helping to make those better predictions, lowering the cost of prediction. But there's a big difference between prediction and judgment. We have currently half a dozen different projects in early stages in the health space. And in almost every single case, these are support tools that better inform decisions that have to be integrated into existing processes or can be used to help invent new processes. We've talked about the opportunity in Alberta, and I think it's worth emphasizing that in any ML project, you've got the data, you need to have the data science team, and you need the subject matter expertise. We do have all 3 of those ingredients in Alberta. All that said, I don't want this to come across the wrong way. I'm a little bit of an outsider in this room. I'm a tech entrepreneur, not necessarily someone who's been in health. But when we were raising capital, those in the know and been in health for a long time said that we were absolutely crazy trying to do this. Crazy, maybe, / stupid. Maybe we're too naive not knowing the system. But when all the ingredients are there, we should be able to put these things together. And even when you go within the business community and those on the outside, like you look at the Impact Luncheon, our Mayor Iveson talked about there's applications within health and AI. Multiple times it was brought up. You keep on hearing across over and over and over. Unfortunately, we don't see a whole lot actually being done. And so I think it's good to talk about the potential here, but we need to face some of these realities. And frankly, as an outsider to the system and someone who's trying to get things happening, we need help and assistance from organizations like Health City. Reg's vision has certainly been, Reg and his team has certainly been inspiring in terms of wanting to change and open up possibility. I think there's a lot of other organizations. I mean, a lot of respect for Dynalife and Jason and their ability to jump in and get something done. Alberta Innovates really seems to want to change things, especially from the highest levels. How do we actually adapt? So I think we can do it. I think there's enough people together. We just need to get some wins. And maybe those are small little examples, but if we get a few dozen bets out there, there's no reason why we can't start changing the culture and getting out of our own way so we can actually seize this opportunity. Thanks very much.